Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Mindy Spigel and Kathleen Bartholomew. Thanks for joining us today, Kathleen and Mindy.
You're welcome.
Thank you for having me. I'm excited to be here.
You're welcome. We've been waiting for a long time, so I'm happy that we were able to make this work. And by way of a brief introduction, Mindy Spigel is a nurse and author who is passionate about creating exceptional associate and patient experiences. And Kathleen Bartholomew is a nurse leader, author, health culture expert, and president of Nurses Transforming Healthcare. And today we'll be talking about how your books and your work is supporting doctors, nurses, and patients. And I've read your books. They're awesome, and I can't wait to talk about them. So, Mindy, there's a snake on my head, and I have stories that I could relate to that. It's subtitle Strategies for Alleviating Fear and Anxiety in Healthcare, and I love it. And Kathleen had sent me her book, Speak Your Truth, Proven Strategies for Effective Nurse-Physician Communication, and also the Dauntless Nurse Communication Confidence Builder. And these are so important in building trust and safety. So I'm really excited that we get to have you on and discuss these important topics. And I always start by asking what you'd like our audience most to know about you. Kathleen, would you like to go first?
Sure. I absolutely love nursing. I didn't choose it as a profession, kind of stumbled into it, but I'm very passionate about nursing and feel that the profession is really, humanity hasn't caught up to us yet. We're going to elevate the values that nursing represents of caring and healing to society.
Mm-hmm. That's beautifully said. Thank you. And Mindy, what would you like our audience to know about you?
Well, I also, just like Kathleen, I am very proud to be a nurse. I think I was born to be a nurse. Every cell of me is a nurse. I clearly remember one day early in my career driving to work thinking, I get paid to do this. It's that much of a passion of mine. And that's what I've really dedicated this last part of my career to, is trying to help our patients and families have a wonderful experience, but equally that the healthcare team is having a wonderful experience and can love what they have done as much as I have. So other than that, I think you've covered who I am in your introduction.
Well, thank you. And that's, very powerful, what you're both trying to do. And it's all about the team. It really is. And now everyone working together to give great care to the patient. So, yes. And Kathleen, would you like to share a story with us about your why?
Sure. Especially with physicians, there's a story that really strikes me. One day I came onto the nursing unit. I was a manager, a new manager, really. And it was like the energy was like the aftermath of a storm. It was very quiet. And I looked around, somebody had tears in their eyes, and a couple people were missing. And I said, what happened here? What's going on? And where's Molly? And they said, well, Molly's in the bathroom with a nosebleed. And I'm like, a nosebleed? And they said, yes, her blood pressure went up and she's so upset. She's just trying to calm down. I'm like, what happened? Well, Molly's patient was going to be discharged and he had a history of an ileus. And when she did her morning assessment, she noticed he still hadn't eaten food after his hip surgery and that he had no bowel tones. So when the physician came in, she said to him, she gave her report. And instead of being receptive, he screamed at the top of his lungs, did you go to 10 years of medical school? Did you? Did you? Then shut up. And, sent her scattering. So I left a message for the physician to meet me in my office, to come to my office. And when he did, later that day, he said, so what did you want to talk to me about? Like, had no clue of the impact. So I explained the impact and the need to communicate better. The next day, when he came onto the floor, he went up to the chart by the room, and Brenda was the nurse. And he looked at her and said, you do understand that had I been able to communicate, I wouldn't be divorced, don't you?
Mm.
And that's it. And she said, yes, doctor, I get that. And so they went in, they saw the patient, and they were about to leave. And he signed off, and he was about 20 feet down the hall when Brenda got an idea. She said, Dr. P, and he turned around. And she looked at him and said, we don't want to divorce you.
Mm-hmm.
And it was that moment where so much healing happened that it's about the relationship. And I love that story because all of my work is about the relationship. You can't teach collaboration and communication. It's about how people feel and acknowledging how they feel. And, so much emphasis has been placed on the patient that sometimes nurses get resentful and physicians as well. But in order to keep our patients safe and deliver the most optimal care and healing, what we need to do is create that caring environment for each other.
Mm-hmm. Absolutely. Caring leadership and everyone caring about each other. That's so important. And that's a beautiful story, the way it ended, right? And I believe that story is in your book, right? I think I remember, reading that.
It's one of many true stories.
Yes, right.
All
There's,
true.
Yep, there's a lot of good stories in that book. Mindy, anything you'd like to respond to what Kathleen said? And then I'd like you to share a story too.
Oh, love what you've just said, Kathleen, and I totally agree. Really started out, I think I started my entire career being an advocate for that, the patient experience as a new graduate, all of 21 years old, at working in a general pediatric unit of a general hospital and seeing how things weren't very pediatric focused. They weren't geared for children. And that was probably the beginning of that journey. Then did my research about what patients' fears and anxieties were. But then in March of 2020, one of my favorite nurses looked at me and said, Mindy, I'm so worried I can't focus and I can't concentrate. I'm afraid I'm going to make a mistake. And March of 2020, things were changing by the moment, right? And she was scared. And at that moment, I realized that all the work and the research that I had done with patient experience also applied to the team, the same things. And what we learned from the research was patients and families needed keep me informed, keep me safe, keep me comfortable. So did Rachel at that exact moment. She needed to feel safe and feel comfortable and know what was going on in the midst of this pandemic, right? And a lot of the work I had done before that was other things, just didn't realize that the reason was about that snake. Kathleen mentioned how you focus a lot on patients, but we forget that until the healthcare team is having a great experience, we can't even begin to talk about the patient experience. Rachel summed it up in those couple words that she needed to get that snake off of her head. So I kind of touched on my why when I introduced myself in terms of the fact that my why is that I want every physician, nurse, clinician, whatever, at the end of their careers to love it as much as I did at the beginning. I can't say they did. I did at the beginning. And very personally, my son is a new physician. He's still in a fellowship. He's passionate right now about what he's doing. And I want him to have that passion at the end of his career.
Yeah, I love that. And thank you so much for sharing. And all of this is so important. And I'm just so glad to have you on talking about it because I often say everyone wins when physicians are well. And sometimes people ask me, well, why are you focusing on physicians? Like I'm a physical therapist, but you may both know I'm doing this work because my doctor took his life. So even though I'm focusing on physicians, it's really everyone wins when the team is well. And that's why I wanted to have you on together because the whole team is important. So to have you as nurses speaking to that. So Kathleen, anything you'd like to say in response to what Mindy shared and also about how your work is so critical in building trust and safety with the team?
Sure. Mindy talked about the pandemic and stressors, the stressors on nurses and the healthcare team. And I'm coming to realize that uh, instead of addressing the symptoms, we really need to address the cause, and that the current system is not built. Its foundation is not built. It's built as a business, but it's not built with the goal of supporting nurses and physicians and giving us the best care. And that is a system design. It's nobody to blame for that. But when you look at the time and motion studies of the amount of tasks that nurses have done, the last one was in 2017, it's like over 400 tasks in a shift, and no task lasts longer than 2 minutes and 45 seconds, and you've got 7 to 8 items, they're called stacking items, in your head that you're going to do. That's task saturation, and our field of vision narrows when we have so many tasks to get done. And because we're human beings, we don't see somebody who needs help, somebody who's disgruntled, etc. I mean, just like in a police car chase, that's why they stopped them, because the policeman was so focused on the car, that he did not see the woman with the carriage in the walkway. And so I have a fear and a concern that we've really reached a point of no return, and I believe the system will collapse the way we know it, because it needs to be built up on a foundation of caring and service, and the belief that everyone has the right to do well.
Yeah, well, hopefully us talking about these things, and my word of the year is impact, and sharing these stories and to raise awareness, because patients have to know and care too. And if we all start raising our voices, hopefully we can figure out how to make a change. And I want to start like an international coalition. And we're all involved with the Healthcare Reinvention Collaborative, and they've been talking about the two loops model, and how, any system, right, rises and peaks and then collapses, and then something else takes its place. But in this case, we need a bridge. And that's, I think, what we're all trying to work out and figure out together, because if the healthcare system collapses, we're all in really, really big trouble. So how can we get to, what's coming next? So Mindy, anything that you would like to respond to what Kathleen or I just said, and if you want to share a little more about this, and then I'd be happy to tell a brief story myself.
Okay. Well, no, I agree with what Kathleen has said, and I've always been so impressed, Kim, with your commitment to making a difference. It's been so apparent your passion since I first met you. So,
Thank you.
yeah, I'm good on what has been said.
Well, thank you. So what I'll do is I'll just share. It's just kind of spontaneous. I had the idea, how your book, personally resonated with me. So as you both may know, or some of the audience, that I've had cancer a few times since the pandemic, thyroid, then bilateral breast cancer, and I had a complication from my thyroid cancer, and then the medication I was put on for the breast cancers um, damaged my uterus. I just needed a total hysterectomy. But I was so terrified of experiencing a complication that I don't think I really tuned into everything they were telling me about, just the things that could happen, or the recovery period and all that for my surgery. And it took like over twice as long as I thought, like the recovery and stuff like that. And whether or not, I had or hadn't been told like everything, I would say maybe I was, but there was a snake on my head, right? And that I was so fearful of experience a complication, like that was the snake on my head, that I really maybe couldn't take everything in. If you'd like
Yeah,
to speak to that,
I
Mindy.
would. Let me back up and explain for the audience what that analogy of the snake on your head means. So, if you are afraid of snakes, and there was a snake on your head, and some people go, well, I'm not afraid of snakes, but everybody, when I say, what if it was a rattlesnake and it was on your head and it's shaking its rattle, would you be afraid? And at that point, everyone goes, yeah. And so imagine there's a snake on your head, and I come in and I say, I have really important things to tell you. How much would you hear with a snake on your head? And so, as Kim just demonstrated, you can't hear anything when you're afraid. I'm a nurse, and my husband had stage 3 colon cancer. And I absolutely felt like he was the only person who had ever had stage 3 colon cancer. I was in one of my hospitals, so not a foreign place, with my colleagues taking care of him. And I started writing everything down people said to me, because I'm a note taker, I just automatically do. And I one day looked back at my notebook and I said, I never heard that. They never told me. Well, I'm a nurse. It wasn't a foreign language. I wasn't in a foreign place, and I couldn't hear them. Of course, they told me it was in my handwriting. I heard it, but I didn't hear it. And at that point, I realized that how much is everybody else missing as well. So I had done some research. I got 4 amazing nurses who were bilingual. I live in San Antonio, Texas, so bilingual was important. And they interviewed over 200 patients and families about their fears when they walked in our doors. And they realized everybody walked in our doors afraid. The fears varied, but they were all afraid. But to me, the most important part of the research was across the board, inpatient, outpatient, surgery, and ER. They said, keep me informed, keep me safe, and keep me comfortable. And until people feel safe and feel comfortable, which is different than being safe and being comfortable, right? You have to feel safe and comfortable. As Kim just said, you can't hear anything. Think back to my Rachel story. What did Rachel need? Keep me informed, keep me safe, and keep me comfortable when she was afraid and had that snake on her head. How often are our healthcare team members afraid, anxious, worried, and have that snake on their head? And what impact does that have when they can't really hear? They're not doing their very best. They can't really focus. And some more common things than a pandemic that people experience is a new boss. The new boss walks in, or because, well, what are they going to change and what do they want from us, right? A brand new job, if you go to a new place, or change, and healthcare is changing constantly. So we change the EMR, it throws everybody off, right? And so that's happening all the time. And how do we deal with that snake when people are experiencing that? So, Kim, I'm sorry that you've had to experience it personally in such a way.
Yeah, me too.
But you did a great job of bringing that to life. Thank you for sharing.
Yeah, well, thank you very much. And all that you were saying is just so important. And we can have Kathleen speak to the role that communication plays in all of this, because as Mindy has shared, there's a snake on everyone's head. You know, everybody thinks the doctor's walking around being fine, but so many doctors have shared their thoughts of imposter syndrome. Right, and we don't know what's going on in their personal life. They're walking around with snakes, and then nurses as well. There could be a toxic leader, you know, like anything. So it's like I think we all we're all walking around with invisible snakes. And, you know, communication is so important. So, Kathleen, anything you'd like to, you know, respond to what Mindy shared or what I just said?
Sure. That's why the title of my book is Speak Your Truth. And that's what the patients need. They can't be comfortable and safe unless we all speak our truth. And I think it's important to acknowledge that the research that shows that it's not like we're having conversations that are turning out badly. The research shows that we're not having the conversations. We self-silence because of that snake. That snake is silencing us. And every voice is important. And if you can create the environment as a nurse or a doctor, if you can create the environment where everybody feels safe to speak up, and then that's our actual goal, to keep patients safe. You know, that's our oath to them, is to provide that healing environment. Unfortunately, communication has gotten a rap as a soft skill. And in the future, I guarantee you, the research already supports the fact that it's not a soft skill. It's a critical skill. The AACN standards say that we must be as competent in communication as we are in our clinical skills. Now, if that is true, how do they measure that? Is communication on your annual ed day? Is right. It doesn't, I mean, even though it's built into the training for nurses, we don't assess communication and whether our doctors and nurses are speaking up. We don't assess whether they are the level that they can speak up. So you really don't know how quiet people are. And the job of a leader is very important in creating that atmosphere and role modeling that atmosphere. Even if you say to a physician, for example, can I speak to you for a moment in private, and bring a physician into your office if something has happened, no one knows what happens in your office, but what they know is that you addressed it, that it wasn't okay. You didn't just stand by and witness it. And also the role of the witness when you see someone who is belittled, or even let's just even be more vague. One day there was a really strong cardiothoracic team in the operating room, and one of their nurses went on vacation. And that morning, a nurse from the ortho team had to come into the room because to replace that nurse who was on vacation. As soon as she opened the door, the physician looked up from what he was doing and went,
Mm-hmm.
That's it. That's it. Is that because of dislike, or this was a mean person? No, this doctor was used to having this smooth team that he had confidence in. And here was somebody new that he didn't know. I mean, so that should have, like, for example, never been, so he shouldn't have been surprised. Somebody should have told him earlier, and reassured, and a checklist for the skills, and needed to be addressed afterwards. And I'm sure it wasn't.
Mm-hmm. Right. And that's to your point that nonverbal communication is so much, and right, isn't 75 or 85% of our communication is nonverbal. And that would have changed the dynamics in the whole room and not for the better. And speaking to what you just said, I just had two conversations yesterday. One was with a doctor who's going to be forming an empathy lab for med students. So we were talking about crucial conversations and how important, communication is in that. And then I spoke with a new physician just fresh out of residency who had had a horrible residency experience, and they were told not to speak up, to just put your head down and keep going. And they were belittled if they did speak up at all. And it was really horrible. So, Mindy, what would you like to respond about
Yeah.
communication?
There's a lot in what you've just said. First of all, I am thrilled that you said that you would talk to somebody who's starting an empathy lab for physicians. I think that's great. My dream has always been that, they have standardized patients in med school where they practice their, critical thinking, going through the differential diagnosis and all those kind of things. I want to sit next to their faculty member, and while they're looking at how well they're doing all of those things, I want to look at how well they're connecting with people and communicating. I've gotten the privilege of shadowing many physicians who were reluctant at first, but then afterwards said, well, thank you, because you've kind of held up a mirror for me. I didn't see how I was communicating, and no one has given me feedback on that in a long time. So I'm thrilled that there's that opportunity to help people learn to communicate better, whether, to Kathleen's point, whether it be to patients and families or whether it's to the healthcare team. I think there's a lot of opportunity to. I'm not sure we do really well in training people on how to have difficult conversations at those difficult moments, like when the stress goes up and that snake comes out and we're not thinking well and we get angry. And often, by the way, when you see somebody really angry, what's usually right under that anger is fear, right? And we've already said there's lots of times people, patients, families, and the healthcare team might be afraid, and then we're not our very best selves.
Mm-hmm. Right. And underlying anger oftentimes is fear. So when you think you're angry, you should dig a little deeper and, what's really going on here. And sometimes it's fear. And when we get off this recording, I will connect you with that doctor. I'm sure she would love to hear from you. She really, really would. So that's exciting. And Kathleen, what else would you like to speak to in regards to communication?
Well, I'd like to refer back a second to what Mindy was talking about with empathy, and you mentioned the empathy lab. So last week I was listening on the radio to NPR, and it was a statement by, I think, the right Christian leaders on empathy. And so I was curious. And the statement was, quote, they want people to know that empathy is not a good thing. And they said, quote, where else would the devil hide if not in empathy? And I think that we have to be really aware of the stories or the things that are going on around us. To me, empathy is absolutely critical. And I think that doctors and nurses who care deeply will actually show that we have more mirror neurons biologically because of our capacity to empathize, and that we have to preserve it. I mean, but there's groups out there who are devaluing it,
Yeah.
and many groups that are devaluing it, saying it's not only important, it's like don't feel for other people. So
Yeah, I just recently started hearing that really empathy is important, and you're exactly right. I mean, I think that's why we all went into healthcare, right? We went into healthcare to help people to feel their pain and to help them, right? And that's where what I've been hearing lately is that's where compassion comes in, and that is taking action with our empathy. You got to feel that empathy first and take action. And that's where compassion comes in. And that's what helps healthcare providers, because if you just keep taking on everyone's pain, it's hard. But if there's no empathy, oh my gosh, who wants to be cared for by somebody who's totally lost their empathy? But then compassion, being able to take that action after you feel that, is really what is powerful.
well, yeah, there's an
So,
energy that happens when our path crosses another. And that
yeah.
energy affects us both. Some transforms, creates the conditions for, sets the tone for self-healing. I think that what we do is undervalued because there's no billing code for it. There's no billing
Yeah.
code for empathy. There's no billing code for a dozen stories that both you and all of us could tell, about moments that really meant something to us and then resulted in healing. But you can't charge for those because it's not a business. So any profession, when what you do is not valued by the dominant group, people have a tendency to stop valuing it themselves. And empathy is also, a soft skill. I love that Cleveland Clinic empathy video. I know it's been around for years, but I could just watch it every year. Yesterday, I was speaking to a group of high school students who wanted to enter the medical field, and like highly recommended that. That's where they start. That's where it's going to start.
Wow. Well,
Yeah.
so share
Love
that.
that. Thank you.
Yeah, thank you. Share that link with me and I can put it in the show notes, when we're off of here. That would be terrific. And yeah,
And
go ahead,
Kim, I'll
Mindy.
share with you also, Brene Brown has a great empathy video as well. I use both of those in my classes. They're very powerful. I'm
Well,
glad you brought that up, Kathleen.
yes, please share that link because in the conversation I had yesterday with the doctor about the empathy lab, someone else was in our conversation and she mentioned that exact same video. And I think it's not very long at all, right?
No, no,
So,
less than
okay,
5 minutes.
okay, terrific. Yeah,
And
so
it's powerful.
yeah, right. Well, definitely. And I think some of it too is in training, medical training, doctors, and I don't know to what degree nurses are actually taught, not really to empathize with the patient, right? Because it feels like, I guess, like if you had too much emotion, it would, like overtake you. But that's not human, right? So then if they try to learn to compartmentalize, and then when they get home, either they don't process the thing that happened to work, and or they do that at home as well, and it really affects relationships. So some doctors now are speaking out and saying that's the worst advice they were ever given. That you have to like feel your feelings, and that's what makes your work mean. When you think of the why, is that what makes it meaningful is to really be present with the person that you're with, and whether it's a colleague or a patient. So, well, thank you. I love everything that you shared, and I can't wait to share this episode as we start to wind down. Kathleen, is there any last words you'd like to share, and also how our listeners can get in touch with you?
I would just like to ask everyone who is listening to thank a physician or nurse.
Yes.
There's just not enough thank yous, and especially a little handwritten note is so important. It goes home and gets posted on the fridge. It means a lot. So that's what I would like. And you can get in touch with me through LinkedIn.
Okay, fantastic. And I actually had a huge push for Doctor's Day for everyone to send a thank you to their doctor. And what also came from that is Dawn Veselka's in Florida, and she has a program called Cards to Warriors where she was sending cards to caregivers and patients with chronic illnesses. But now she started a program that's also to thank medical warriors, so anyone on your care team. So I'll actually put that link in our show notes as well, Cards to Warriors, because she can send you a free card that you can then pass on. And she actually got it instituted a couple hospitals near her that they're putting those on the carts, the volunteer carts. So then patients can spontaneously take a card and thank someone who's impacting their stay while they're at the hospital. So thank you so much for spotlighting that. And Mindy, what would you like to share and how can our listeners get in touch with you?
Well, thank you. Well, I would first like to say to healthcare team members that my ask of you for the rest of your career is every day when you drive home, instead of beating yourself up all the way home about all the things you wish you had done better, that you wish you had said, that you wish you had more time for, stop it. And you can blame me. You can say that person, Mindy, told me I have to do this. But every day when you drive home, ask yourself, how did I make a difference today? Because every day, every one of you is making a difference in people's lives. You've touched their lives. They will never forget you. And if you stop and think about that, it begins to refill your cup. Going to what Kathleen said, for those of you that appreciate your healthcare providers, I agree. Tell them that they do, because that helps reconnect to their why. That helps remind them why they're doing what they're doing. My husband, who I mentioned earlier, just hit 10 years. And when we got to his 10-year anniversary, I thought, I bet his oncology team, his doctor, only sees the patients who relapse and come back.
Mm.
So I wrote him a thank you note and told him that we hit our 10th anniversary, and because he's not seeing this doctor anymore, he was discharged 5 years ago from this doctor. I said, he's alive and kicking and doing great, and thank you. We wouldn't have been there without you. And I wrote to his surgeon as well. And so just remind people how the work they do makes a difference, and they'll have that will help refill their cup. So.
That's beautifully said. And how can our listeners get in touch with you?
Oh, I forgot that part. Probably the easiest way to reach me would be on my website, which is mindyspigel.com. And then that will give you a link to my LinkedIn site, or you could look on, it's just Mindy Spigel on LinkedIn as well. It also gives you a link to my book. It gives you a link to my TED Talk. If you go to my website, everything's there. So mindyspigel.com. Thank you. Thanks so much for asking.
Oh, you're welcome. And I love the way you said that you're all making a difference because I've had even an emergency room physician on here and who had said like she went to work some days not knowing if she's making a difference. And because sometimes you only hear about the bad things, right? And nobody's thanking you, even when you're like literally saving people's lives every day. So
Yeah.
every doctor, you're right, and every nurse, like you can't go to work and not make a difference, so that you have to feel that deep inside you. So I thank you very much for sharing that. And I'm just so excited that we got to have this conversation and here's to nurses too, right? Because a lot of this is about doctors, but I know, good doctors will say behind every good doctor is a good nurse, right? Or a team of nurses. And I love that we're spotlighting the importance of the whole team. Yeah.
Thank you, Mindy, and thank you for all your work.
Thank you. Yeah, this has been a joy. Thank you, Kim, for having us. And
Yeah, Kim.
it's been a joy.
You're very welcome. And I will use this opportunity because by the time this goes live, my book might be as well. If you guys know, I compiled a book with 15 physicians, white coats, courageous hearts, true stories of doctors reclaiming their humanity in a system that challenges it. And around the time this episode goes live, the book will be available in paperback. So,
Kim, that's great. That sounds wonderful.
it really is. It's like 15 doctors just sharing their beautiful, like story. Well, really raw story. I would say raw and beautiful, because they share, and how they've come out on the other side, and what they're doing, kind of like, like you guys have shared the things that we can all do. And actually it's going to be a series, and I'm taking the YouTube channel episode, so eventually you both could be a chapter in my book. So you will have an opportunity. I will reach out. So
Thank you.
You're
Thank you
welcome.
so much.
You're welcome. And now we're all authors.
Yep.
So, how I end every episode, I say, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.